The story of Dr. Reza Ray Ehsan, a life in pain relief. Pain is something most people try to avoid. But for Dr. Reza Ray Ehsan, understanding pain and helping people live with less of it has been the focus of his life's work. Based in Los Angeles, California, Dr. Ehsan is a board-certified anesthesiologist, an interventional pain management specialist. He has over 30 years of experience treating patients with both acute and chronic pain. His journey into medicine started early, shaped by someone very close to him. "My father was a family doctor," he says. "He was always there for his patients. I saw that growing up, and I wanted to follow in his footsteps." Dr. Ehsan's path to pain medicine wasn't typical. He started his education studying chemical engineering at California State University, Long Beach. "I liked solving problems," he says. "Engineering made me think logically, and that helped me later when I got into medicine." He went on to earn his MD and completed his internship at the State University of New York in Brooklyn. He then trained in anesthesiology at Loyola University of Chicago. During his final year, he completed a fellowship in cardiothoracic anesthesia and interventional pain management. Anesthesia is about control. Dr. Ehsan explains, "You're managing a person's pain during the most critical moments of their life." That responsibility stuck with me. Over time, Dr. Ehsan saw that many patients continued to suffer long after surgery. The original problem might be gone, but the pain remained. "That's when I realized pain itself can become the disease," he says. Chronic pain is complex. It often doesn't show up on scans or blood tests, but it's very real. Dr. Ehsan believes that understanding this complexity is key to helping people. Pain is not just physical, he says. It's emotional. It's mental. It affects every part of your life. At LA Downtown Medical Center, where he is chairman of the anesthesiology department, Dr. Ehsan leads a team focused on finding the right mix of treatments for each patient. This might include nerve blocks, injections, regenerative therapies, and sometimes counseling or mindfulness practices. "I always tell patients, healing isn't just about medicine," he says. "It's about how you think, move, and even how you sleep." One of the things Dr. Ehsan talks about often is the link between pain and the brain. Stress, trauma, and anxiety can all increase how much pain someone feels. "I've treated people whose pain didn't start with an injury. It started after a loss or a trauma," he says. The brain doesn't forget those things. That's why he supports a more holistic approach to care. He encourages his patients to look at the whole picture, body and mind. "When we treat only the physical, we miss the full story." He adds, even with a busy hospital schedule, Dr. Ehsan makes time for humanitarian work. He has provided free medical care in the Caribbean, Mexico, and other underserved communities. "I believe medicine should be available to everyone, no matter where they live," he says. Sometimes just showing up with the right tools can change a life. He's also worked with organizations like Doctors Without Borders and provided free anesthesia for children with cleft lips and palates. In California, he's helped families through the Children and Paternal Services program, making sure they receive basic medical care. Service, he says, is part of his identity. "It's not about being a hero," Dr. Ehsan says. "It's about doing what's right." Outside of the hospital, Dr. Ehsan stays active. He enjoys hiking, running, and volleyball. He says movement is not only good for the body, but also clears his mind. "I tell my patients to move as much as they can," he says. "Motion is medicine. Even a short walk helps." He also writes and reflects on his experiences through journaling. It's a habit that keeps him grounded in a profession that can be emotionally heavy. For Dr. Ehsan, the future of pain management is exciting. He sees promise in technologies like wearable devices, AI-assisted diagnostics, and regenerative medicine. But tech is just a tool. He adds, the heart of medicine is still the same: listening, caring, and doing your best to help someone feel human again. At the end of the day, Dr. Ehsan says, success isn't measured in titles or procedures. It's when a patient tells me they slept through the night or played with their grandkids again. That's what matters. For Dr. Reza Ray Ehsan, helping people move beyond pain isn't just a job, it's a calling, and one he continues to answer every day.